Episode 3, COVID Control. In the last episode, we learned about one person getting COVID. But the tricky part is that viruses spread from person to person. The field of study that does this is epidemiology. To explain COVID in populations, here's Meena Bewtra from Penn. Hello, Meena. How have you been?
Hello, Churik. I have been very well. Thank you.
Tell us a little bit about yourself.
Well, I am a doctor. That's my MD degree. And then I also got a master's in public health, an MPH, with a focus looking at biostatistics and epidemiology. And then finally, I actually went on and got a PhD in epidemiology. And epidemiology is the study of health in populations of people and also how to control health problems in groups of people.
Can you explain exactly how you work with COVID in populations?
Well, as an epidemiologist, disease in people is exactly what we do. So this is our bread and butter. COVID was a very, very busy time for all epidemiologists. And I know you have talked to some basic scientists, and they are really focused primarily on the mechanism of the disease. But as an epidemiologist, we're really focused on the person or the groups of people who get illnesses like COVID or cancer, heart disease, diabetes. And I got to say, people are a lot more complex than a virus or an organism. And groups of people are even more confusing and complex. You got to think about all the ways that people interact with each other and all the different things they do or they don't do. So with respect to COVID, what we really focused on were understanding what does COVID do in an individual person, all these different types of people? How does it affect a group of people, like a school or a city or a state or even an entire country? And then figuring out what's the best way to study this? How do we design the study so that we can look at this, knowing that it's going to be really complex?
Okay, so what do you do if somebody gets infected with COVID and has been around other people? What do you do with those other people?
That's an excellent question. So first of all, I think it's really important to understand that there are multiple things that can be done on both sides of this equation, right? You've got your infected person, and then you've got the person who has been around the person who's had COVID. So first of all, remember, everyone can wear a mask, right? So this helps decrease the spread of illness. If you feel like you might be a little bit ill, put a mask on. It helps protect everyone around you. And if you think you might be around somebody who's sick, wear a mask. I work in a hospital. I wear a mask all day because I am taking care of people who are sick. And I do not want to spread one sickness to another person. Second, if you are around someone who is sick, or going to a crowded place where you don't know if they're sick, you can wear a mask. And even if they are not, it will protect you. So if you are worried about that, you can do that. And finally, and I think this is the most important thing, everyone should be vaccinated. If you are 6 months old or older, which means if you're listening to this, you should have gotten vaccinated and gotten boosted. This is going to help you if you get COVID from dying from COVID or getting what we call long COVID, which are long-standing symptoms even after you're done with the infection. And these are really awful. And I've seen these even in kids and athletes where they get so sick for such a long time, they can't run up a hill. They can't run one block. They may actually have memory loss and have difficulty remembering things. You don't want that, and it's preventable. So it's easy to get vaccinated and stay up to date with your vaccines and your boosters.
So, what quick data can you provide about infection in America?
I love data. I listen to lots of science, like people who are smarter than me talking about COVID or epidemiology. So, and unfortunately, and I give a lot of talks on this. So I do know some facts off the top of my head. And some of these are really sad facts. So about 1.2 million people in the United States have already died from COVID. COVID is the 8th leading cause of death in kids. Think about that for a second. And despite us now entering this new phase where we've ended the emergency response, we still have 300 people dying every week from COVID. The majority of these people are older, they have underlying health problems, or they did not get vaccinated. So at least part of this is really preventable. We can help stop stops the spread of COVID to people who might die, but we can all get vaccinated and get everybody else vaccinated to help prevent those numbers. We shouldn't have those numbers.
Okay. Well, say you've already talked about places like people going to places getting COVID, but what can make you getting COVID have a higher chance in a certain place? What aspect?
So yeah, so there are a lot of things. If you think about any infectious disease, let's say COVID, for example, but it could be anything, you think of it like an invisible sticker, one of those, maybe those blue light stickers you can't see unless you actually have a special light on it. You can't see it, but it will spread to anyone with whom you have contact. So that, if you think about it like that, there's some things that become really obvious. If you live in a really crowded place, you're going to have more infection. Or if you live in a place that doesn't have good ventilation, like doesn't have good windows or good air conditioning indoors, that's going to have increased spread. And because we know COVID specifically spreads through air, through our breathing, if you're in a place where people are breathing really hard, like if they're playing sports or they're singing, it's going to be more easily spread, especially if that's happening indoors and with poor ventilation. But I also want to take the other side of this. There are also things that can decrease infection rates. So if you're wearing a mask, less spread, especially if people are vaccinated, that decreases spread. And I like to think of vaccines like a Mission Impossible instruction. It teaches your immune system to fight off the virus and then it disappears. But now your immune system knows what the virus looks like and it knows what to do if it sees it. And that means if you get exposed to that virus, your immune system will fight it off faster. And that means you get less sick and you don't spread it as much. So we see a lot less spread of COVID in places that have high vaccination rates.
Okay. Well, what parts of COVID make it so hard to control that it became a pandemic in the first place?
Well, for a while, we didn't know anything about it. It was new. And so it took us a while to figure it out. And then we didn't have vaccines. And that took a while too, just because we just were really relying on this keeping people away from each other, wearing masks. It's hard to do when we're living, day to day. Also, specifically with COVID, a lot of people don't have symptoms for a few days. So they can spread the virus without even realizing they're sick. And that makes it hard to control. But I think the biggest reason COVID has been so hard to control is that we have a huge anti-vaccination and anti-science movement that is spreading a lot of disinformation and misinformation. So spreading a lot of things that are wrong about vaccines or about COVID, and it makes it very hard to get the right information. And so this is why I'm so happy you're doing this podcast. And I hope that people who listen to this learn from it and spread their own correct information. And if you hear something, look at it. Think about who's saying it. Is this coming from a scientist, a doctor? Is it coming from a CDC or a public health department? Or is it just something on the internet that you read and this person really doesn't have any reason to say it? And if you have questions, ask a doctor, ask your doctor. We need to spread the correct information so that people are relying on science and not fear.
Thank you for your time, Meena, and have a good day.
You too. Thank you.